Hello everybody. So I'm doing a quick video today it's a video update actually, in regards to my last video about degenerative disc disease and dealing with it, living with it. So I am 10 days away from having my surgery, or maybe less than 10 days. I have my surgery on March the 4th. Since my last video, I have been to the ER 3 times. The last time I went, which was just 2 weeks ago, I was admitted for several days for pain management because the pain was so bad and nothing was working in the ER. So they ended up admitting me. They did a CAT scan, I think, and then they came back and said they were admitting me. So I got admitted. I was like heavily medicated for the first 24 hours, and then they eventually started trying to help wean me down to get my pain under control. And so I came home. I was taking just 2 medications. I came home on 5 medications. So they added a lot of pain medicines to the mix, but I think the thing is to keep me always something in my system to keep things as calm down as possible. But this is the situation since the last time I talked. I have degenerative disc disease on my left side from C2 down to C8 or down to C7. I had a slip disc at 6 and 7, a herniated disc, however you want to call it, whatever it is, it's out. The vertebrae are like this, and the nerve that runs in between that has been smashed for going on 2 years. And so I have what's called cervical radiculopathy. And it has crushed the nerve. I have very bad pain on my left side. I have spasms. I have what I can only describe as electrical shocks. I don't know if anybody's ever had an I want to say it's an electrocardiogram where they put the electrodes on you and run the little electric stuff through you. That little shock, intensify that times 10, and that's what I have in my neck, down my arms, running across my back. I have that all the time now. And I've fallen several times. Due to the fact that I learned now that I was falling, because I have, in addition to the 6 and 7, I now have 5 and 6 that have slipped out, and 4 and 5 that have slipped, and 5 and 6 is pressing on my spine. So I've been having, like, I would describe it as these Russian headaches that start back here in my neck, and it's like a buildup of pressure, and it just shoots up here and causes me to lose. I get very, very dizzy. My eyesight is terrible, and I've fallen several times, and I hated it because my daughter was pregnant, and I was falling 9 months pregnant and can't help me really get up. So it's just been a crazy whirlwind. And so I'm about to have the surgery. I am a little bit apprehensive, but I am a woman of faith. So I'm going to pray my way through this situation. And I don't know how soon I'll be able to give you all an update. But I just want to say, if there's anybody else out there dealing with this, make sure that you don't let it wait too long. In the meantime, from my last video, I had went to physical therapy, and my hand is shaking because that's just how I do. And so I apologize for the shaky video, but that's a part of what I'm dealing with. So, yeah. And it's no better with the other hand. Actually, it would be worse. So this is as good as we can get it, and I'm going to cut this short. But if you're dealing with this, go and get it taken care of as soon as possible. Don't sit back. Don't wait for it, because the longer you wait, the worse your condition could become. So I will try soon after my surgery. I don't know how soon, but I will be doing a video diary. So I may be able to put up some pictures in a video form as I go through the process. So you all just keep me in your prayers. I'll be talking to you all soon, or you'll be seeing pictures soon. I'll do something once I'm able to go home. And so you guys take care, and I'll talk to you later. Bye.